Alright, so I'm Dodds, Physio. We're just going to talk about a couple of muscle release techniques that can help you to eliminate a little bit of back pain. Kind of back pain that you're getting if maybe you're really active and you start to feel really tense here, or if you do a little bit of a back bend and you feel like a lot of pressure or a bit of discomfort right down low. What's interesting about that is that a lot of the times, like first, maybe we need a lot more core strength here to help coordinate and control motion. Usually it's strength in the middle, mobility at the hips, and mobility at the T-spine. That's what we need to be working with. So we're just going to look at the hip stability component here today, or sorry, the hip mobility component. So a lot of people sometimes will do some rolling using the foam roller on different areas around the hip, maybe working with the glutes in a position like this, which can be a pretty effective position and a good use of the foam roller, where you can go pretty much all the way from down at your sit bone and then roll all the way up to the crest of the pelvis, or like your belt line. You can also roll like laterally, so you kind of get on there and then just sort of shift your pelvis until your pelvis is pretty square on the roller, and back, and just kind of back and forth in those angles. This is with the leg already kind of pre-positioned with a bit of a stretch onto the glute muscles, so it's pretty effective getting in there. Some other things that we can do, we'll be using a smaller diameter pipe. So I've got a 1.25 inch and a 2 inch, and just getting into the hip area. So starting from this seated position with a straight arm, nice and upright in the trunk, snugging that up against your hip, and then just lying right down. So you can see that there. Sitting just above my hip bone and below the crest of the pelvis. So it's pretty much like where your belt would be running. Once you're there, you can roll back a little bit. You can get onto some of those tight glute muscles again, or you can roll forward and try to get onto the front side of the hip. To get onto the front side, you actually have to push that bottom leg straight so that you can roll a little bit further. Often this works best when you do keep that bottom knee bent so that you can be dropping the foot down towards the ground. And then from there, if you need to, you can kind of shift up a little bit on the pipe so that it's just going to roll down a little bit and get really snug with your hip bone here. Once you find something that feels really tight, basically just hang out there and take a few deep breaths. Sometimes being in the position for 20 seconds is enough. Sometimes you might hang out for 1 to 2 minutes, but you don't need to be like really aggressive here. Basically, you're just trying to make a little bit of a change in the muscle tone, or the intensity that those muscles are kind of contracting with. And once you've done that, you probably want to do it on both sides. You can stand up and just retest your movement, see if it feels a little better. If it does, then you're kind of starting to figure out which things are really influencing your back mobility and taking some of the pressure off your low back by helping your hips move better. So going from that 1 inch pipe up to a 2 inch pipe, if you feel like the 1 inch is no longer really getting in there as deeply, or sometimes using a lacrosse ball or a baseball to get into those muscles as well. Those are some really good options. Okay? So those are a few of the things you want to try if you need to take a little pressure off your low back and just be able to move a little better. If you have some chronic back pain and stuff like that, that was really recommended. Go ahead and get checked out with a professional. All right, have a good day.